So now what we really want to see on IVUS is, do we have a landing zone for our stent that we can try and stent to? And we've also got to make a decision about how high we take the stent up. You have to cross completely through the inguinal ligament. You can't, the screen there. Let's see where we are. So we're coming up to the lesser trochanter. That looks a lot better now, doesn't it? Actually, there was a reasonable profunda there. Yeah.
Looks a lot better here, doesn't it?
Yeah. So we probably need to take the stents all the way up into the common iliac vein here. We're not going to get away with landing it just at the bottom of the pelvis or just under the ligament where things go wrong. So we'll take the stent right up to here. So if we're going to go back to that lesser trochanter, how many centimeters do we need to stent? 1, 2. And the reason for taking the stent up high is there's 2 points of compression of the stent. So at the ligament, you get problems with the stent, and if you overlap the stent or end the stent under the ligament, you can come into issues. And then you have to go either in the external iliac vein in the midpoint of it, or take it round the bend at the bottom of the pelvis into the common. If you leave the stent at any of the other points, you can end up with problems. So that's our distal landing zone there. As we're looking back and forward on the IVUS, we're trying to see that profunda. There's a trabeculation there that is sitting in the middle, and hopefully that will break up when we put the stents in. But that's a little bit of a concern for me as to what that bottom of the stent, the inflow, is going to be like. So we'll see what that looks like at the end, but that's where we want to land our stent.
Just to that?
Yeah, so what did you, so if we mag up on that image there, please. Mag up 2 on that image and transfer it to the other side.
So I need a 19 minimum.
So we'll do a 150 and then extend with the... So we have a 14 150 upraised stent, please.
Yeah.
Okay. Is that mag 2? Take a picture there.
Can you mag 2 there for me, please?
Okay. And if we take that image across to the other side? Yeah, that's great. Thank you. Okay. So we're using, because we're coming across the ligament, we kind of tending to use open cell stents more often under the ligament at the moment than the closed cell stents. There isn't a huge amount of data to show a big difference between the two, so this is not an evidence-based decision. It's what we're trying to do is look at the differences between the stents, and we've got a long experience of closed cell stents under the ligament. So using a few more of the open cells now to see if we can find any difference between them. So we've measured the ACT after the heparin dose, and we've got an ACT of 293, so we're happy that the patient is fully anticoagulated.